Hello friends, welcome to my channel Doctor Online 24/7. Today I'm going to tell you about malaria. Malaria is a life-threatening disease. It's typically transmitted through the bite of an infected Anopheles mosquito. Infected mosquitoes carry their Plasmodium parasite. When this mosquito bites you, the parasite is released into your bloodstream. Causes of malaria. Malaria can occur if a mosquito infected with the Plasmodium parasite bites you. There are 4 kinds of malaria parasites that can infect humans: Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium falciparum. Plasmodium falciparum causes a more severe form of the disease, and those who contract this form of malaria have a higher risk of death. An infected mother can also pass the disease to her baby at birth. This is known as congenital malaria. Malaria is transmitted by blood, so it can be transmitted through an organ transplant, a transfusion, use of shared needles or syringes. Signs and symptoms of malaria. A malaria infection is generally characterized by recurrent attacks with the following signs and symptoms: moderate to severe shaking, chills, high fever, sweating. Other signs and symptoms may include headache, vomiting, diarrhea. Malaria signs and symptoms typically begin within a few weeks after being bitten by an infected mosquito. However, sometimes malaria parasites can lie dormant in your body for up to a year. Diagnosis of malaria. Blood tests can show the presence of the parasite and help tailor treatment by determining whether you have malaria, which type of malaria parasite is causing your symptoms, if your infection is caused by a parasite resistant to certain drugs, whether the disease is affecting any of your vital organs. Some blood tests can take several days to complete, while others can produce results in less than 15 minutes. Treatment of malaria. The types of drugs and the length of treatment will vary depending on which type of malaria parasite you have, the severity of your symptoms, your age, whether you're pregnant. Medications. The most common anti-malarial drugs include chloroquine, quinine sulfate, hydroxychloroquine, mefloquine, combination of a debauch-win, and proguanil. The history of anti-malarial medicine has been marked by a constant struggle between evolving drug-resistant parasites and the search for new drug formulations in many parts of the world. For instance, resistance to chloroquine has rendered the drug ineffective. Homeopathic treatment of malaria. The most useful homeopathic medicines for malaria with profuse sweat stage, are Boletus and Eupatorium perfoliatum. In cases of malaria with severe chills and fever, as well as excessive sweating, particularly at night, a homeopathic drug called Boletus is administered. Thanks for watching. Please remember to like and share the video. You can also subscribe to our channel to receive notifications of new videos.